falls far short of what is needed to keep workplaces safe. And that's why we're seeing so many outbreaks in essential workplaces. That's why communities with essential workers are 3 times more likely to have COVID cases than communities without essential workers. That is why paid sick leave is good for business and essential to keeping our economy and schools open. So, Speaker, will the Premier admit that the federal sick leave benefit falls far short of what is needed and actually work with us to pass a sick pay bill that works for Ontarians?
Thank you very much. Minister of Labour to respond.
Well, thank you very much, and I thank the member opposite for this question. Mr. Speaker, the very first piece of legislation that we passed when COVID-19 hit Ontario was job-protected leave. So any worker who's in isolation and quarantine, if you're a mom or a dad who had to stay home because you're looking after a son or a daughter because of the disruptions in the education system, you couldn't be fired for that. Mr. Speaker, we went even further. We eliminated the need for sick notes. And Mr. Speaker, back in the summer, thanks to the leadership of Premier Ford and other provincial and territorial leaders, they signed an agreement with the Prime Minister. 2 weeks of paid sick days are available to the working people here in Ontario. And Mr. Speaker, I'm proud to report to the House today that over 110,000 workers here in Ontario are now receiving sick day pay through the federal government. We've worked with the federal government to raise awareness of this program and to ensure that people get paid more quickly. And in fact, Mr. Speaker, 80% of the payouts are being done within 3 days.
Thank you. The supplementary question, back to the member for Guelph.
Speaker, in the same way that the government is dragging its feet on delivering paid sick leave that actually works, they've also been dragging their feet on deploying rapid testing. Finally, after months of asking for rapid testing and reports revealing that the government wasn't rolling them out, they finally announced last Friday that we would start seeing the deployment of rapid testing. But this is cold comfort for long-term care homes who do not have the staffing needed to administer rapid tests. So will the Premier provide the funding that long-term care homes need to administer rapid testing to keep our workplaces safe and our loved ones safe?
Minister of Labour. Minister of Long-Term Care.
Thank you, Speaker, and thank you to the member opposite for the question. The rapid tests are another layer. In fact, in Wave 1, our government was pushing for rapid tests, but we could not get them because they were not available yet through Health Canada. We were well ahead. In Wave 2, the Premier pushed, and so did I, to make sure we could get those rapid tests out to our long-term care homes as another measure. We, at this point, we have over 1 million rapid tests that have gone out to our long-term care homes, 1,213,140 to over 500 homes. We were required to do a pilot, which we did, to be cautious of what the impact of these might have. We made sure to understand the implications and the use of rapid tests. So this has been ongoing. We are making sure we support our homes. Over $1.38 billion has gone to our homes to support them in prevention and containment, including other measures for staffing. This is unprecedented, the support that these homes are receiving. Rapid tests.
Thank you very much.